Hi everyone, in this video I'm going to talk about the landmarks of IM injections. Number 1 is the deltoid muscle, number 2 is ventrogluteal, number 3 is vastus lateralis. Normally we choose right or left deltoid muscle for intramuscular injection and we do look for the landmarks. So let's see what are the landmarks we check while you give the intramuscular injection on the deltoid site. In the shoulder joint, we can see the union of three different bonds. Number 1 is clavicle, the other one is scapula, and the head of the humerus. When you check the landmarks for the deltoid muscle, you check for the acromion process and you feel the acromion process. You can see that the muscle here and see the scapula. Here is the clavicle and this is the axilla and this is the humerus. You can see close to the humerus the brachial artery is passing, also radial nerve is passing. So when you do the intramuscular injection, you have to be very careful to prevent any accidental damage to any of the blood vessels or the major veins or the nerves passing through this area. When you check the landmark for deltoid injection, you feel the acromion process and keep your index finger there. 2 finger breadth below the acromion process, that is the space between your middle finger and your ring finger, that is the site of your deltoid injection. Or you can keep like an imaginary or a central here, you can feel the acromion process and you can keep like 2 inch apart from this point, right and left, make an imaginary V and the center of the V you can select that as the injection site. So these are the landmarks for deltoid muscle intramuscular injection. So whenever you administer injection here, in some hospitals or some instructors prefer to aspirate, but normally in hospitals, the vaccines, we do not aspirate. Otherwise, we can aspirate, but it's all depends upon the hospital protocol. Please follow the hospital protocol for that. Okay. The next intramuscular injection site is Vastus Lateralis. Vastus Lateralis, a muscle which is starting from greater trochanter of the femur and which ends at lateral condyle of the femur. So let's see how we check the landmark for Vastus Lateralis. Use your palm of your left hand, feel the greater trochanter, and you know that greater trochanter which is at the hip joint and where the femur head meets the sacrum with that ball and socket joint, and the femur head is inserted or joining with the sacrum with a cup-shaped structure known as acetabulum. So you feel the greater trochanter at the hip. Here you keep your left hand, you keep against the greater trochanter and you keep your right hand either one breath above knee or you feel the lateral condyle and you see that this muscle is laterally aligned. So we check the landmarks in an oblique position and you make that imaginary rectangle between these 2 palms and the center of the rectangle is going to be your injection site. Okay, I think all of you are clear about this concept. So let's move on to the next injection site, that is ventrogluteal. Ventrogluteal is most safe to use, which is the most preferable site because patient does not complain that much pain. So less pain and more safest area. But still we have to be very careful because you know the femoral artery, femoral vein, all these are passing through the groin and we have to be very careful about selecting the site. And for the proper selection of the site, we need to know the landmarks. So let's talk about the landmarks for ventrogluteal. So first thing, you select the site, either right or left side. You ask the patient, where did you get the last injection? So you select right or left. When you use the left side, you use your right palm to check your landmarks. The same way, when you use the right side of your patient, use left arm for the landmarks. So first thing, you are looking for the greater trochanter. So you feel the greater trochanter with your left hand when you inject the right side of the patient. So I use my left hand, I use my palm, I feel the greater trochanter. Greater trochanter. When I feel the greater trochanter, my thumb is facing the pubic symphysis. Pubic symphysis is formed by the union of two sacral bones anteriorly. So whenever you check the landmarks, feel your palm here. When you feel the palm with your, when you feel the greater trochanter with your palm, your thumb should be facing pubic symphysis. Your index is facing anterior superior iliac spine, and your middle finger is facing the iliac crest, like this. So you get a V here, and you select the center of the V as your injection site. Mainly three areas you are looking. You are looking for the greater trochanter. You keep your palm against that, and you're looking for the superior anterior iliac spine, and you're looking for the iliac crest and middle of the V. That is your injection site. You have to be very careful when you give the injection at this site. You can damage the blood vessels and nerves, so be careful and select your site.